No functional requirement for cutting all this nice tooth structure coronal to these buccal and lingual pulp horns. You cannot use a sharp-tipped ultrasonic device for this function. Look at how big the lingual pulp horn is. Again, when we leave the nice tooth structure coronal to this area, we create an excellent undercut that's going to help lock in our post-endodontic buildup. Regardless of what some bonding guys say, you're always better having mechanical undercuts as well as chemical adhesion holding the restoration in place. This is a Spartan Buck 1A ultrasonic tip. It has the same round-ended tip geometry but half the diameter of the Buck 1, and is typically used to cut out the isthmus areas between canals and mesial roots of lower molars. This is especially important to do in retreat cases. Here's the final test. Can I put a file in each line angle at the cavo surface, then smoothly and continuously drop into each of the canals? We've achieved that outcome. Excellent. Despite the advances in other procedural aspects of endodontics, negotiating root canals is still an art form. Like it or not, if you can't consistently get to the ends of root canals, it really doesn't matter what procedures you do thereafter. However, if you use a lubricant during negotiation, you can avoid pulp tissue blockage. If you start the process by taking tiny instruments through the end of the canal, you can keep the canal patent throughout the procedure. And if you use an apex locator during this negotiating process, you're going to know right where the root canal ends. By sticking to these three negotiating requirements, you will be able to sneak your way to the ends of root canal systems and own them. When you can achieve that outcome consistently, endodontics will become endlessly satisfying and you'll be practicing the art of endodontics. So let's see how to make it happen. There are many brands of lubricants. The brand you choose to use is less important than the fact that you use a lubricant during all negotiation procedures. I like ProLube by Tulsa Dentsply because it has a single dose dispenser. Simply clipping off the tip allows us to fill a molar access cavity 4 or 5 times, usually getting us to the end of the negotiating procedure before we need to get a new tube. In large teeth, typically a number 10 K file is the first instrument taken into place. These are extracted teeth, but in a real case, I would use an apex locator with each negotiating instrument, taking it to the point on the display of the Merida Root ZX where it indicates a 0.5 millimeter short. That is where the file tip is at the junction of the internal and external surfaces of the tooth. Notice in this microscopic end view how small the number 15 file is compared to the apical diameter of the terminus of the canal. When using an apex locator in this situation, you will typically get an irregular signal until you get to larger files which come closer to binding that apical diameter. Even a number 25 K file is quite a bit smaller than that apical size. So we have a 19.5 millimeter length from the canal terminus to the reference point. In this case, we've started with a number 10, but we had to go to a number 25 to get a file to bind at length. You may either choose to take a radiograph with the 25 in place, or if you're using safe-ended files, you may choose to accept the very accurate length shown by the apex locator and move right into the shaping phase of treatment. In small roots, such as those of lower anterior teeth, we're always going to start apical negotiation procedures with a number 08 K file. A number 10 is too large. If you move into the apical third of these canals with a number 10 or larger, you could easily block yourself out with vital pulp tissue. With coronally constricted canals, a file is placed to its binding point with apical pressure. A back and forth watch winding motion, moving through less than 90 degrees of rotation, is used until it tightens up in the canal. Then 3 or 4 pull strokes are used to loosen the file, after which apical pressure is returned to the instrument, it is watch wound again, and hopefully it drops further into the root canal. Once length has been achieved with the 08 K file, as confirmed by the apex locator, the stop is adjusted to the reference point. I measure it and find that it's a long root, 24.5 millimeters. I try to read to 1/4 millimeter increments. Here comes a number 10. It's a small size jump from the 08 to the 10 file size, so when an 08 gets to length, usually a 10 will go there as well. Once these instruments are moved to length, we must take them 1 millimeter long to ensure that the end of the canal is patent or open, and then we rotate these files back to length as indicated by the apex locator. Let's see what happens with a number 15 file. Quite often in small roots, going from the 10 to the 15 is problematic. There are a lot of different workarounds to this challenge. Some clinicians say to work the 08 and 10K files in 40 or 50 push-pull strokes. Some clinicians use a half size, a 12.5K file between the numbers 10 and 15. While these procedural strategies may work eventually, I've found it simpler and quicker instead to do step-back enlargement with a number 20 and 25K file in a balanced force technique. In this case, after using just a number 20 file in a couple of cutting motions, I've created enough shape in the coronal 7/8 of the canal to allow the number 15 to easily and passively achieve length. When a number 15 exhibits tight resistance to apical placement, it is almost always binding in the coronal 7/8, which explains why using just one or two larger files allows the previously bulky file to achieve the intended length in such a canal. Multi-rooted premolars are classified as small root structures. We're going to start with a number 08K file. Unfortunately, an impediment has been encountered. The file is loose in the canal. It is not advancing further, so I'm going to put a little bend on the file with an endo bender plier. I make sure the teardrop stop that I put on this negotiating instrument is pointing toward the bend in the file, and I'm going to go in and hunt for a way around the impediment. I'm going to visualize what that file tip is doing and look for a passive canal path with which I can take it to length. I move it in with a certain direction, and if I meet the impediment again, I pull it slightly back out, turn it in a slightly different direction, and move the file apically again. Oh good, I've got a little sticky feeling there. That's what I'm looking for. I'm going to pick into the canal path where I got a little catch. The sticky portion of the canal means the file is back in the center of the canal instead of engaging an impediment with the file tip. I watch wind the file in that position, and as I look at the teardrop stop and see which direction the bent file tip was in when I danced past the impediment, I have now mapped the canal path irregularity, and I don't need to hunt for it anymore. I'm literally going to put the bent file in and go in that previously determined direction. In this case, I have to move the bent file tip in a buccal direction to bypass the impediment. Okay, I've got an 08 to length. Awesome. Of course, in a clinical case, I would then use an apex locator to confirm this length. I measure it, and this is my initial negotiating length, 19.25 millimeters. After I've confirmed that I can take a bent file to length, I take a straight number 10 file in to see if the impediment is still there. So obviously, if the canal form is past the number 10 file test, I'm going to put an unbent 15 file in. Now, a little bit of watch winding. Apical progress is made, but it's resisting placement to full length. Instead of overworking an 08, a 10, or a 15 file, I'm going to do the balanced force technique with a number 20K file. I ensure patency after the use of the larger file and will now watch how, with no serious work, the number 15 file drops to length with a watch winding pull motion. And I'm to length. The file went long, and then I rotated it back in a vernier movement, which would be done with an apex locator in place, followed by setting the stop to the reference point. And once we get a number 15 or larger to length, we consider the canal to be negotiated and ready for rotary instrumentation. Negotiating a mandibular molar. As usual, I'm going to fill the access cavity with a lubricant. I'm going to start in one of the mesial canals. It's a small root, so I'm going to start with a number 08K file. This is the mesiolingual canal, I believe. I use a watch wind pull motion, and I've been able to achieve patency. That was easy. I back it up to full length in the canal, measure it, and see that it is 21.5 millimeters. I want you to notice that quite often we lose 1/4 millimeter just between the 08 and 15K files. In most canals, if the 08 goes to length, a 10 will usually go as well. But let's see what happens with a 15. This is often the most challenging instrument to get to length during negotiation of small canals. You know, this is not meeting very much resistance. Let's see if it's going to go. Without horsing it in, it doesn't want to go, so I'm going to use a number 20K file with a balanced force movement. If I use a larger instrument to make more shape, I need to be careful about leaving debris at the end of the canal where it could be compacted by an instrument with a tip size that is close to the apical diameter of the canal. So I'm always going to clear the end of the canal with a small file that will passively move through the terminus. Notice how the number 15 that was previously hanging up a millimeter short now passively drops to length. Just smoothing the canal path has shortened that canal length by 1/4 of a millimeter. Now for the other mesial canal with an 08 file. It looks like it's getting close. Push on it, watch wind, and it gets tight. Pull, watch wind, and there we go. You can often, especially in necrotic cases, feel the file tip drop past the terminus as you achieve patency. Okay, we've got 21 3/4 millimeters. I stick the number 10 in. So what you're seeing is a negotiating technique that's very consistent and predictable, and all the extra steps have been eliminated. We're not coating each file with a lubricant, we're filling the access cavities so they're all automatically coated. I've not started with an 06, and 08 will almost always move to length in small roots. We're not starting with an 08 in medium or large roots because it's unnecessary. If we can't get the 15 in place, we'll use a 20 and or a 25 with a balanced force technique. Then after getting patent with a 10, I bring the 15 back in and find it drops easily to length and with control. Again, we lost 1/4 of a millimeter during that negotiating procedure. Here we are on the distal root. The number 10 easily went to length. So nice to have an easy canal shape, an easy canal negotiation process, and at this point the 10, 15, and 20 have easily gone to length. The apex locator would tell me that I'm long, and I would rotate the file back into that 1/2 millimeter position on the meter display, and measuring it, it reads 23 millimeters to the mesial marginal ridge as reference point. First, I fill up the access cavity with a lubricant. My access cavity prep allows me to drop each of my files effortlessly into each of the orifices. The MB1 is a small canal, so it's begun with an 08K file. I have tight resistance to apical file placement. I use watch wind pull motions, loosening up the instrument, and allow it to traverse more deeply, but I'm meeting increasing resistance. So instead of overworking the 08, I'm going to use the number 10 without attempting to get it to the same depth. I just want to open up the coronal 7/8 of the canal a bit. I'll even bring in a number 15, especially when I know I have a lot of canal curvature. I want to bring in the 08K file again with a bend on it because I felt an impediment. The instrument is now more easily placed, and check it out. Using a lubricant, putting a bend on the file, creating a little bit of coronal enlargement with the 10 and 15 instruments, allowed my file to glide around the S-curve, and with the teardrop stop, I have now mapped the canal curvature. I will no longer have to hunt for the canal path. I simply put my pre-bent file into the canal in a mesial direction, then in a distal direction, and then again in a mesial direction to get to length. Now I have a bent number 10 file taking the same path as the 08 all the way to length, which is typical after an 08 goes. I do a little push-pull filing to loosen it up, and then the number 10 usually will go as well. I have an 18 millimeter length in this canal. Here's a number 15. I really don't expect it to go to length. It's a big jump in size from the 10 to 15, especially when I'm in a canal with severe curvatures. What I'm really looking forward to is creating a little bit of shape with this instrument. It's bent. I want to make a little bit more shape using the balanced force technique with the number 20, being certain not to take it to the same length. Now, here's the 10, assuring patency, making sure there's no debris collected at the end of the root canal to compact with the number 15 file. And when I take it back in, it's bent. I made more room with the number 20. Now for the distal buccal canal. Watch wind and pull motions. It's a small root, so I'm going to start with an 08K file. Initially, I'm feeling tight resistance to apical file placement, and when it doesn't go, I use the number 10 and the number 15 shy of that length. Then the 08 penetrates further into the canal. Again, I'm advancing further apically with the 08K file, and in this case, it still feels tight. This is unusual, so I resort to taking in an 06K file with a little threading motion to see if I can gain further apical depth. 06K files are typically unnecessary in canals unless they are really tortuous. These tortuous canals do tend to narrow around these curvatures for some developmental reason. And cool, the 06 is taking a length. So now I'm going to work the 08, and we see the file coming out the terminus. This gives me a really happy feeling. The moment that you get patent in a canal with that first file, The chances of successfully treating that canal have dramatically improved. It's a common myth that irrigating with tap water or anesthetic solution is as good as any other irrigant. This is simply not true. This SEM photo of a dental surface after irrigation with water illustrates the incredible layer of debris left in canal walls with this regimen. What we need to effectively clean root canal systems are two solutions proven since 1975, 6% sodium hypochlorite and 17% EDTA in aqueous solution. Sodium hypochlorite is more time dependent. It is necessary for sodium hypochlorite to be in the root canal system 20 to 40 minutes depending on whether it's a necrotic or vital case, while EDTA solution only requires 30 to 60 seconds to accomplish its objective. This is an SEM photo of a canal wall. The left side was instrumented, the right side was not instrumented, but both sides were irrigated with sodium hypochlorite. We see that the right side is remarkably clean, with pulp tissue ideally removed, leaving the natural calcospherite projections of uncut dental surfaces, but the left side is dirty. This is the smear layer resulting from abrasion of those surfaces by the root canal instruments. The next SEM photo shows both the instrumented as well as the uninstrumented surfaces, left and right respectively, after irrigation with both sodium hypochlorite and EDTA solutions. Both sides are clean. So it is a truism that files, while they cut dentin very effectively and grossly debrided canals, do not actually clean those surfaces. It is the irrigants that clean the canal walls. Without the right irrigating solutions, in effective concentrations, and with sufficient time needed to do that project, we will not get the job done. I will now introduce my new GT Series X files, the next generation of shaping instruments in the field, by first discussing the design improvements and then showing their use in several cases. These are the first rotary shaping files on the market to combine safety with rapid cutting efficiency. Before this file, clinicians had to choose safe files or fast files and deal with the compromises that choice presented. No longer is that necessary. We can now have our cake and eat it too. First, GTX files are more resistant to breakage when used correctly. This was accomplished through the development of M-wire, a new form of nickel titanium that has significantly greater resistance to cyclic fatigue. Of course, if you overuse them, like any rotary file, they can break. But with this new wire, the chance of separation in curved canals has been dramatically lowered. Second, these files have radius tips and landed blades just like the standard GT files, so the resistance to apical ledging and transportation of the original canal path so loved by GT file users has been maintained. That is critical in curved canals if avoidance of perforation and accuracy of obturation is desired. Third, cutting efficiency has more than doubled because of the variable width lands designed into these instruments. Thinning the land widths at the tip and shank ends made them cut faster. Holding the mid-region lands to their original width has prevented any increase in mid-canal straightening. Fourth, the helical blade angle has been decreased, doubling the chip space and thereby allowing for twice the length of cutting cycle before these instruments stall and must be removed. This is a big factor in reducing the total time needed to finish canal preparations. Additionally, this smaller blade angle has made them more flexible. The stiffer the file, the shorter its life in curved canals. Fifth, the latch grip handles have been shortened from 13 to 11 millimeters for easier use in posterior teeth. And finally, we have reduced the size of the file set from 15 to 8 instruments and designed a technique for use that requires only 1 to 3 rotary files to cut a final ideal shape. I think you will agree that with all these design improvements, the GT Series X file line is the most sophisticated shaping instrument in the field. Let's see how they are used and how well they perform. The first shaping procedure we are going to show you is in a central incisor. This tooth has a straight canal that is fairly large along its whole length. As with all cases shaped with GTX files, the first instrument to be used is a 2006. The 2006 immediately cuts to length, therefore a 3008 is brought to play. An 08 taper is appropriate for a medium or large root. Remember, these files work with extended cutting cycles. As long as the file is advancing, we let it continue, but of course, as soon as that apical progress stalls, we pull it out, clean it, and use it again if necessary. Now I am gauging to determine whether the apical preparation is sufficient. As I expect, the number 20 NiTi K file drops through, the number 30 drops through just a bit, and the 40 binds 3/4 of a millimeter short. Therefore, visual gauging and tactile gauging reveal that we need to finish this preparation with a 0.4 millimeter apical size, so a 4008 GTX file is brought in as the final instrument. After the 4008 cuts to length, we see debris in the tip flutes. This visual gauging result should correlate with a similar tactile gauging result. As we see here, the 40K file drops just to length.